Okay, I'm going to start with some good news. The good news is today is the last lecture before the exam, which means after we finish this class, you can study, and then maybe this is bad news. I don't know. It's the last lecture before the exam. So next class time, make sure you log on to Blackboard to take the exam. And the exam will only cover what we've covered in class. So make sure you go back and read the chapters of the textbook that are on the syllabus. And as you'll note, there are some portions of particular chapters that I just didn't cover. So the parts of the chapters that I haven't talked about and didn't put on the reading list, you're off the hook on those. Good news number 2 is that this last chapter, chapter 6, is pretty short and it's pretty easy, so you won't have too much extra stuff to try to learn today before the exam. The title of chapter 6 is the hospital industry, and one thing I'm going to just start with is something that a lot of people don't know about hospitals, and that is that hospitals don't necessarily employ the doctors who are working at the hospitals. So because of this, one thing that we say about hospitals is that hospitals are often the workbench for physicians. In other words, many doctors go to the hospital, they treat patients in the hospital, and then they use the hospital as kind of this tool or this facility to provide care, but it's a tool for the doctor. So the doctors aren't actually employed, or the doctors are not employees of the hospital. So this kind of creates some weird incentives, and the one that I want to highlight today is that because physicians sometimes are not employees of the hospital, doctors have very little incentive to help control hospital costs. Okay, hospital administrators are going to be important in this story. So hospital administrators are the people who kind of run the hospital and make the business decisions, and hospital administrators are the ones who control the budget for a hospital. Importantly, administrators are not medically trained, so they can't always judge whether an investment in a particular technology or medical machine or device is going to be cost effective. And so what they have to do is they have to rely on the input of physicians when they're deciding whether or not to adopt a new medical technology. Okay, put yourselves in the shoes of a doctor now. So doctors, they use hospitals as workbenches, and then administrators are coming to them and saying, you know, there's this new machine that was invented and we're thinking about buying it. We don't know if it's worth it. What do you say, doctor? It's always going to be in the doctor's best interest to have a nice workbench or to have like lots of fancy equipment in the hospital. And so if you're in the position of a physician, there's very little incentive for you to tell the hospital administrator not to invest in that machine, because even if it's a bad investment, well, you're not an employee of the hospital, and so if the hospital is kind of financially not doing well, that doesn't directly affect you as the doctor. And as the doctor, if you can tell your patients that this hospital that I'm working out of has fancy machines and they've got a helipad and all the walls have new paint and everything's sparkly, then that's great for you to potentially attract patients, and it's just more fun to work in nice fancy hospitals. So the tendency that we're going to see is that physicians are always going to have the incentive to encourage hospital administrators to kind of overinvest in medical technology relative to what would be the cost-effective decision. Okay, this is going to result in a sort of downward spiral. So as soon as the doctor says, hospital administrator, yeah, I think you should definitely buy that machine, then the hospital administrator, if they're listening, they're probably going to go ahead and order the machine. In many cases, that purchase is cost ineffective, and so the costs for the hospitals are going to go up. Okay, now the hospital has to pay for this huge machine, so what is the hospital going to do? They're going to raise their prices. Okay, as we talked about, health markets are just weird in a number of respects, and here's another respect where they're weird. In most markets, if a price goes up, then this is a discouraging thing in terms of having customer retention, because people don't really like high prices. And so in most markets, suppliers have to keep their prices somewhat low in order for them to remain competitive in the market. The catch in this world is that in healthcare, the person who is consuming the healthcare, or in other words, the patients in the hospitals, most of the time, they're not the ones that are paying the high hospital bills. So these high prices that the hospital charges because they have to pay for these machines that they've purchased, well, the consumer in this case, the patient, they don't really always feel the effect of a high price. And the reason they don't feel the effect of the high price is because most patients have insurance. And so they're not picking up the tab for the hospital bill. In other words, they're not feeling the sting of the high price. It's the insurance company that's feeling the sting. Okay, the reason this is kind of critical to drill into your mind is because the party that's feeling the sting is the insurance company. The party that's choosing how much health care to consume or whether or not to go to a hospital that's fancy and the prices are high is the patient, who doesn't feel the sting of the high price tag. So patients are always going to be kind of going towards the hospitals that are fancier and also have the higher prices, and they don't feel the sting, and so their behavior is going to cause the sting to be kind of really felt by the insurance companies when the patients start gravitating towards the fancy hospitals. Okay, this is going to kind of result in what I'm going to be showing you on the screen. So if you start at the top of this cycle, you can imagine a situation where you have, first of all, assume you have two hospitals in a given market, hospital A and B, and in the red circle, let's say hospital A gets better machines than hospital B, so their administrators are buying like super fancy equipment. As a result of that decision, move on down, hospital A is going to charge more than hospital B for the care that they're providing, and so in other words, prices are going to be higher in hospital A than in hospital B. And what would typically happen, again, in most markets, which is not the case here, is that in most markets, well, the consumers who are paying the prices don't like the high prices, so they would theoretically kind of quit going to hospital A. But in this world, move on down to the blue circle, consumers like the better machines, and consumers aren't the ones paying the high prices. And so move on over again, everyone's going to flock to hospital A that has the fancy machines. It's also the hospital that has the high prices. And then we're going to kind of get into this pattern. So what you might expect to happen after this is if everybody goes to hospital A, well, hospital B is going to have to still back the patients. And how do they attract patients? They get even fancier machines than hospital A had. And so now everyone's going to flock over to hospital B because now it's got the best machines in town. Its prices are also highest, but patients don't care because they've got insurance. Well, hospital A is going to want the patients back, so they're going to get fancier machines, and this is going to result in kind of each hospital in town trying to outdo the other hospital in town in order to attract them. And as a result of this competition, prices are just going to keep going up and going up and going up. Okay, due to this kind of pattern that you can sometimes see in the world, we have a thing called the medical arms race hypothesis. And the hypothesis is this. The medical arms race hypothesis says hospitals compete on quality by adopting the best medical technologies available to appeal to physicians and their patients. This competition results in a race for each hospital to have the best medical technologies available and may cause overconsumption of medical technology. So in other words, a few things in this textbook definition that should be highlighted. Thing number one is hospitals, according to this hypothesis, compete on quality. Quality here is like how fancy are your machines. Again, this is totally contrary to what we see in most markets. In most markets, people or suppliers are competing on price. Like they're trying to make their product cheaper so that consumers will want to go with them instead of the more expensive alternative. In the hospital market, according to the hypothesis, hospitals don't try to outdo each other in terms of low prices. Instead, hospitals try to outdo each other in terms of like having the best machine, having the most sparkly facilities, having all of these technology that they can advertise on billboards. Okay, the second part of that is that this results in a race for each hospital to have the best medical technologies available and may cause overconsumption of medical technology. So in other words, the amount of medical technology that is consumed or the number of machines that hospitals invest in, according to the hypothesis, it may be a larger amount than what is kind of the best amount. So there's an overconsumption of medical technology, and there's no breaks in the system in the hospital market, because the typical break is that prices start floating up and people run away. Now prices start floating up, and in the hospital market, patients don't run away because, again, insurance companies are picking up the tab. Okay, this story holds if we assume the majority of people are insured, which in the United States is the case. But there's a particular group of patients who don't have insurance, and so let's just think about how things would play out if we put ourselves in their shoes. Well, if you're uninsured, then high prices actually matter to you, because whatever your medical bill is, you're kind of liable for paying it. So if the medical arms race hypothesis is true and hospitals are just trying to outdo each other in terms of medical technology, and consequently prices start creeping up, this is enormously detrimental to uninsured patients, because for uninsured patients who get sent the bill, as things start to spiral, their medical bills start getting higher and higher and higher because hospital prices keep rising and rising and rising. I'm going to give you one helpful hint in the event that you don't have insurance and have to go to the hospital, and then that will be it for the day. The helpful hint is that a lot of times if a hospital sends a bill to an uninsured patient, or if they send a bill to a patient whose insurance won't cover the full bill, then oftentimes they just don't get paid, because the bill is going to be so big that it's just not realistic that the patient is going to be able to foot it. So one thing you can do, and nobody advertises this, but it's true, is if you get a medical bill for like $10,000 and you can't pay it, if you call up the billing office and you tell them, I got this big bill, I cannot pay it, and then in their mind they're probably thinking, well, we know that, like, we don't anticipate you're going to pay it, so we're just going to like hand you over to collections. If you tell them, I cannot pay $10,000, I can pay X dollars, will you take that and then wash my account? A lot of times they actually say yes. And I had a friend whose daughter was in the ICU recently, and she got a huge bill, and I told her, I was like, hey, you should just call the billing department and just ask them if they'll cut your bill to a particular level that you can afford, and they actually did it. So in the event you end up in that situation, call them up, make an offer, and hopefully you can get a better deal. Okay, it's super short and sweet for the day. If you happen to have any questions, ask them in the next 10 minutes, and we'll do a quick exercise, and then you'll get some free time today. Okay, so the exercise for today is I just want you to respond to one question in about a paragraph. And the question is, if the medical arms race hypothesis is true, then would we expect to see higher quality, or I'm thinking fancier, hospitals in urban or rural areas, and why? So simply respond, we would expect to see fancier, higher quality hospitals in urban areas, or we would expect to see fancier, higher quality hospitals in rural areas, and then explain to me why you believe that to be the case based on the medical arms race hypothesis. Once you get that turned in, you're done. Again, just make sure you're studying for the exam next class, and if you have any questions as you're studying, feel free to reach out and I'll try to clarify things. Have a good rest of your day.